next speakers are Rebecca Tretheway, I hope I've said that correctly, and Meg Willey, who are going to speak to us about the impact of health pathways in reducing variations in care in general practice.
Hi everyone, I'm Meg Willey. I work as a GP for Wentworth, the Western Sydney Primary Health Network, and this is Rebecca Tretheway. She works for the Science of Knowing. I'm going to tell you about a study we ran that was based on improving quality of care, and we wanted to know whether health pathways could improve the quality of care given by GPs. So most of you probably know about Health Pathways from the conference so far, but it's an online decision support tool for assessment, management and referral of patients in general practice. It aims to improve care between primary, secondary and tertiary care. It's being implemented at the moment by PHNs and LHDs across 27 regions in Australia, New Zealand and other countries internationally. The existing literature on health pathways is really limited. That which is out there at the moment is based on improving quality of referrals, and it does support that referrals are improved by health pathways, and also on service redesign. But at the moment, until this study, there wasn't actually anything out there about whether health pathways could improve the quality of care for patients in general practice. So our objective was to find out whether health pathways can improve that quality of care. So our methods were, we began with a literature review, obviously. Oh, is that not coming up? Yeah, okay. Got our ethics approval from the Sydney Children's Hospital Network, who partnered with us. And we developed 5 paediatric cases of common conditions that we see in general practice regularly. So to develop these cases, I wrote them. I've got some experience in case development, and we had paediatric subspecialists from the Sydney Kids Hospital network to review them, and some other GPs to review them and make sure that they were appropriate for general practice. We piloted the program with a few GPs to make sure that the processes all ran correctly. We recruited participants through convenience sampling, so through our PHN newsletter, through word of mouth, through social media. And then we ran our sessions in our offices in Blacktown, and we ran several sessions each for a control and an intervention group. So the control group were using their usual online resources, and the intervention group were using their usual online resources plus our health pathways, and we really encouraged them to use the health pathways. There we go. And so once we'd done that, we audited the notes. So the cases were presented to the people in their practice software, and then they answered the cases in the software. We took the notes out, de-identified them, and had 2 people independently auditing the notes. To do this, we used some indicators of best practice care, which were developed by Macquarie University in their Care Track Kids studies. So they were indicators of gold practice in assessment, diagnosis, management and referral. We audited those using a rigorously developed marking rubric, basically, with all sorts of points as to whether or not, yes or no, they had met the indicators. Then we did some inter-rater reliability testing on that to make sure that the 2 different auditors had similar results. And then we analysed the data, so we'll get Rebecca to present on that.
Okay, so in total, 50 GPs and GP registrars participated in the study, 29 in the Health Pathways group and 21 in the control group. Analysis on the impact of Health Pathways use was undertaken by comparing participants who had used Health Pathways with those who had not used Health Pathways for each of the 5 paediatric conditions. 5 patient scenarios rather. On average, across all 5 paediatric conditions, participants in the study met 24 of the 42 indicators, saw a percentage score of 57%. Average scores ranged between 14 and 38, which is 32% and 90% adherence, with most common scores between 20 or 48% accuracy. There was no significant difference in the overall scores between participants who used Health Pathways compared with those who did not use Health Pathways when completing the study. When looking at the 5 patient conditions individually, the average number of indicators met and percentage scores were higher for those who used Health Pathways compared with those participants who did not use Health Pathways. While only one of these differences was statistically significant for Gore, there was a consistent trend that suggests that participants who used Health Pathways met slightly more of the clinical indicators than participants who did not use Health Pathways across these 5 paediatric conditions. What is also evident from the results is that with the exception of bronchiolitis, scores for both groups across all conditions were quite low. For the control group, percentage scores ranged from 30% for obesity to 56% for asthma, meaning that on average, participants only correctly met between 1/3 and 1/2 of the clinical indicators for each condition. The results for participants who used Health Pathways were higher, but still only ranged between 37% for obesity and 68% for Gore. Oh, that's a bit touchy, isn't it? There we go. So in addition to evaluating the impact Health Pathways had on participants' adherence to clinical indicators and quality of care, it was also important to understand the impact of demographic characteristics on how the participants responded. There were statistically significant differences between the results of GPs versus GP registrars, the length of time a GP had been practicing, and by age. The demographic characteristic with the greatest impact on results was age. Percentage scores were statistically significantly correlated with for 3 of the 5 patient conditions, so for ADHD, bronchiolitis and Gore. As participants' age increased, the overall number of clinical indicators met decreased. Further, 35 of the 42 indicators showed this trend, suggesting that age has a significant effect on patients' quality of care. The results of this study showed that participants who used Health Pathways to assist them with assessing patient scenarios scored slightly higher than participants who did not across all 5 conditions. However, these differences were generally not statistically significant, especially once demographic differences were accounted for. Nonetheless, tests for statistical significance are typically very conservative, depend largely on sample size, and may not reflect clinical significance. For instance, the adherence to an additional 1 or 2 clinical indicators out of a total of less than 10 indicators may make a substantial difference to the quality of treatment and management care provided by a healthcare professional. The consistently slightly higher results of participants who used Health Pathways during the study across all conditions and all types of indicators suggest that the digital tool is having some impact on GPs' ability to provide quality care through more accurate assessment, diagnosis management and referral. Overall, the percentage of indicators met in this study are similar to those found in another recent study using the Care Track indicators. Both the current study and the study by Braithwaite et al. Showed relatively low levels of adherence to clinical indicators and high levels of variations in care between healthcare professionals, which is also similar to other studies conducted in Australia and internationally. The results of these studies suggest that the results from the current study are widespread and unlikely to be unique just to the Western Sydney region or those participants. The results also suggest that there may need to be more additional assistance for primary care practitioners to ensure their care meets clinical guidelines and results in positive outcomes for patients.
Okay, so just go through some strengths and limitations. So some of the strengths of our study were the rigour of case development, the study protocol, the indicators from the Care Track Kids studies, the blinding of the 2 auditors, so we didn't know whether or not the participants had used Health Pathways or not, and the data analysis techniques. The other thing is that it's novel research, nobody's done this before. Some limitations of the study. It was an audit of simulated case notes rather than actual consultations, but thankfully it was in line with the Care Track Kids studies, which were real-world studies. So, we had a small sample size, and as Rebecca mentioned, that might mean that we didn't reach the statistical significance with improvement with health pathways just because we only had the 50 participants. It was also convenience sampling, which might have meant that it was a biased sample that wasn't representative of GPs in our Western Sydney region. We only measured a subset of indicators, so not a complete spectrum. So, for example, with asthma, there were dozens and dozens of indicators, but for our asthma case, only about 12 of those were relevant to that case, so we couldn't measure all of the indicators. So that might have led to some bias in the results. The other thing is that the pathways that the participants accessed during the sessions were not actually tracked. So for the obesity case, for example, we know that quite a few people used health pathways, but we suspect they used the wrong one, and that they were looking at the foot pain pathways because that's what the patient presented with rather than the obesity pathways. So that might have an effect on whether or not the health pathways are actually doing their job. Some implications of the study for Went West. Obviously, this will contribute to some ongoing funding for health pathways, which is great, and amongst the wider community, continue expanding health pathways, hopefully internationally and across Australia. It means that we're going to have to promote health pathways better to GPs, but also we're going to be able to promote health pathways as a tool that potentially can improve the ability of GPs to look after their patients. It means that as a PHN, we're going to focus on education in obesity, ADHD management, bronchiolitis, perhaps not so much in GOR or, not in bronchiolitis or GOR so much because they did better in those ones. We're also going to want to start focusing more on CPD and refresher courses for really experienced GPs to hopefully get them practicing more aligned with quality care and current guidelines. In terms of future research, we hope that other regions will want to repeat these studies and see how it applies to their regions. The study protocols all going to be very well documented in our publication, hopefully.
Yeah.
And also, ideally, what we would do is an audit of actual case notes before and after the implementation of health pathways. So this might be in a region that already has health pathways, but hasn't done that particular stream, say gynecology or oncology. Or in an a region that hasn't implemented health pathways at all, and to measure case notes before and after the implementation of health pathways and see whether it can have a real world effect on quality of care. And that's it.